This is No Spin Live, and do we have a show for you today? We're going to talk about Cardi B cancels her Memorial Day concert due to plastic surgery complications, and Wendy Williams spills somewhat, some people think, too much information about her breast implants. And we got two incredible international experts to guide you through this episode of No Spin Live, Dr. Jason Posner from Boca Raton, Florida, and Dr. Mark Epstein from the Big Apple, New York City. Let's get into this. This is about Cardi B. In fact, canceled her Memorial Day concert because of complications of plastic surgery. I think it sounded like more just that she was trying to go back a little earlier than was recommended to her, and just, you know, after you have surgeries, I don't know exactly what she had, but some sort of implant exchange and liposuction, and it can be a toll to get back in and perform, and I think like that. But what do you think, Jason?
You know what? I think this is exactly interesting because you put that it's quoted as a complication. I don't think she has a complication. I mean, I think she had liposuction and she had her breast implant exchange, and she was probably feeling a little tired and probably went back a little too fast for it. I mean, I think that, this whole recovery period after different surgeries needs to be discussed. I mean, this is something that I had clinic today. So this is something that every single patient asks, well, how long is the recovery period? Now, the question is, what does this mean? To go back to giving a concert in front of 100,000 people? Or does this mean like going back to work and sitting at a desk? I think it's very dependent on what you're doing. I mean, I operate on a lot of police officers, and the question is, can they go back to work? Well, what does that mean? Like, are you going to chase down a criminal and not be at 100%? Or are you going to be sitting at a desk or giving out parking tickets? I think that there's a whole big conversation to be had for this.
I mean, Mark, people have multiple surgeries. It's like there's always the rate limiting step when you're doing multiple surgeries. You might be taking off a mole and injecting a little Botox, but if you're doing an abdominoplasty, it doesn't matter this other stuff. The abdominoplasty is going to dictate, what the recovery is. So, I mean, she had multiple things done, so she's probably going to have a little longer recovery, right?
Absolutely. I mean, when I'm doing multiple procedures, the rate limiting steps and things I think about are, one, what could cause a higher risk of bleeding, and two, what could damage the work that I did. In the case of a breast augmentation, the technique, I think, varies considerably among surgeries, and those who use a very minimally traumatic technique like you and I, those patients go back to work very quickly. I've had police officers back in a day or two. But if you're going to do an abdominoplasty, you're going to risk damaging the muscle repair, and obviously that's not something that you want to happen. So a lot has to depend on exactly what the surgery is, and then the technique specifically of the surgeon who's doing it.
Yeah, Jason, I couldn't agree more to you. And you said with liposuction, your liposuction patients, what I see is like, it's not terrible pain, but it's much more prolonged than most surgeries. People recover after a few days, they're feeling pretty good, but liposuction, they're sore for a few weeks. And just like you said, if they're sitting at a desk, that's no big deal. But if you're trying to perform and put on, I'm sure Cardi B doesn't wear like hospital gowns when she's performing, so she's trying to put on tight stuff and and dance around, and it's just the lifestyle that you gotta be mobile and on your feet a lot. So I mean, her profession is probably one of the harder ones to get back to after having liposuction.
You know what? And have you ever, you watch her perform, and some of the other performers, they put on some show. I mean, I'm sure they're exhausted after one of their shows. So, kudos to her for coming out about her plastic surgery, and I wish her a speedy recovery. And just, maybe she just needs to temper things a little bit until she's healed. I got a question for both you guys, because, one of the biggest questions I get after liposuction is the stupid garments. I got to tell you, the older I get, the more I hate garments. I was running a panel a few years ago at one of the meetings, and I had experts from all over the world on the panel. And I asked each of them, how long do you have your patients wear the garments? And it went from none, Larry Bass in New York, to 4 months, one of the Latin doctors in some South America. So like the same thing with Cardi B, like, is she wearing a garment? Is she not? What's your guys' experience with some of the garments, and how do you handle them? I hate them.
I do a high definition lipo, and I do pretty aggressive liposuction, multiple sites in one sitting, often circumferential. I think the garments are very helpful. It is very important to have them go to a massage therapist afterwards, and you gauge the progress accordingly. I give them as a rough idea 6 weeks in the garment, but some patients actually like the way they feel and want to stay in the garments longer. The main thing is just to keep an eye on the swelling and make sure, excuse me, that things are progressing properly. One thing that I find works really well, and I got this idea from Simeon Wall, is using foam inserts. So I take Rest-On foam, cut that up and put that in the areas where you do the etching. And it's amazing, you take the garment off the next day and instead of looking, swollen like a toad, you actually see very little swelling in the areas where you put the foam on. So compression, I think, is important, but it's got to be directed compression. So having an insert is very important. And Alfredo Hoyos, who taught me high definition, he's always been a big proponent on having a compression or something within the foam vest. So I think you got to use the two together.
Yeah, no doubt. No doubt. Definitely a two-edged sword. And actually, our next topic is another two-edged sword because, there's been a lot in the media recently about breast implants and breast implants causing problems and illnesses. And, this is actually Wendy Williams who basically said that she was recommending people get their implants under the muscle because she's had hers 20 plus years and she's been doing great. So Mark, what did you think about this one?
Well, I like the way she gave medical advice there, but on the other hand, I couldn't agree with her more. I think for primary augmentation, there's really very little indication to ever go above the muscle. That aside, I think it's good that she's out and she's talking about her surgery and how happy she is. There's, as we were all talking about before off camera, people love to complain, and the media is much more interested in complaints and negativity than positive. And it's nice to see someone who's out there and is in the media and people respect and watch this person, and she's got something positive to say about her implants rather than someone just trashing them.
What do you think, JP?
Again, I couldn't agree more. I'll keep this one short. It's like what we talked a little bit about before we started this segment. You go to a restaurant, you have a good meal, you have a good time. And then how many people have a bad meal and then like to complain when thousands of people went in there and had a great meal? And you'll hear about the one negative review. And the same thing with this. I think that there are some issues with people who have problems, like to get on the internet and complain. And there's millions and millions of women out there with breast implants for years and years that are completely satisfied and happy with their results, never say a word. It's nice to see somebody say something happy. Yeah,
it is a little bit refreshing, but I think maybe for Plastic Surgery Channel, we should give Wendy Williams an honorary plastic surgery degree or something, because I think her comment about under the muscle, we've been talking about that for many years, that there's some small, in my book, very small indications for going above the muscle, but under the muscle, far less problems and far better long term, particularly if people, when they get older, they need to have other things done in the breast. The blood supply of the breast is completely different. So I think Wendy Williams is pretty astute with that comment. Listen, that was great stuff, guys. So thanks so much. And you can see more of this on theplasticsurgerychannel.com.